Having been said, you just heard the Senator mention California in particular and Aetna. Our insurance expert, Craig Gussin, joins us here this morning. The things that I am hearing now, and you can tell me from an industry standpoint, I'm hearing this whole plan that was supposed to cost $900-some billion is now over $2 trillion. Right. They're 6 months behind on stuff that's supposed to happen in 4 months. Mm-hmm. They're at least 6 months behind on that, and the costs are skyrocketing. Any of that inaccurate?
Nope, you're 100% right. I was at a meeting the other day, and they were projecting it's at $2.7 trillion, and it's going to keep skyrocketing.
$2.7 trillion?
Yeah, now? It's crazy. It's they're trying to rush it through, and I wish that they could take a step back and say, okay, we can't get it up and running in time, or we're going to, especially the exchange. A lot of states just can't get it done. California is going to have it done. We have our own exchange, but it is. They want it done January 1, and it doesn't really make a difference, all the glitches and all the problems that we're going to have.
Now let's talk about Aetna in particular, okay, and what that means for folks. I don't know how many folks that affects in California that have individual insurance through Aetna. Now, a lot of folks may have a group plan through their right. employer through Aetna, but what about individuals?
Individuals, Aetna was never, last couple of years have been a big player. They wrote individual coverage. In my opinion, the cost was a little bit higher than what you could get elsewhere. We have
so that's not a huge loss to California.
Not at all.
It's a big headline, but it's not a huge loss to most folks.
Exactly.
Okay.
They're going to be writing group insurance. That's their main thing. It was a business decision, and it made total sense to me. They just decided there's 6, 7 individual companies that write individual plans in California. And it really wasn't what I call a player the last couple of years, and they just made a business decision that we're not going to write insurance. So July 1, you cannot buy a new individual plan.
With Aetna.
With Aetna.
Right, okay.
You can keep your individual plan that you have today until December 31st, and then you're going to go into one of the other plans or the exchange or some option that way.
All right, so that's one of the first things coming down the line. Well, what's the next thing that people should be looking for?
Looking for is your plan's going to change come January, so start looking at what is your plan going to be. If you work with a company, you want to look at your renewals, when the company renews a policy. What we're doing for most of our groups is we're going to renew their policy early, which we've never been able to do in our lives. So anybody who has a policy renewing, even in March, we're going to go back to them in October and say, hey, we can renew your policy. Your rates may be a little bit higher, but I can give you the 2013 plan versus the new 2014 plan with much higher rates and total change in benefits. So that's one of the things you can do. If you have an individual plan, you want to talk to your health insurance broker, and you want to start looking at what options are available. Unfortunately, we don't know that yet. So we'll probably, I would guess, middle of August, beginning of September, we're going to start to have a better idea, because by October 1, everything has to be out there.
The question that I have to ask, and again, you're the insurance industry analyst and the expert on this, so let's take all the media coverage out of it for just a moment. But the whole idea was to improve health care and to get more people insured. But it looks to me like as many people are being negatively affected, in fact, perhaps millions more are being negatively impacted than those are being positively helped. Is that inaccurate?
No, you're 100% correct. You're getting the young people in their 20s to late 30s, early 40s. They were complaining about, I can't afford the insurance now, but yet the new rate's going to be a lot higher.
And we were promised they'd be lower.
And and there's just no way to guarantee everybody health insurance and keep the rates low. I mean, 85% of the people today have health insurance in California. We're only looking at 15%. I've always said from day one, why don't we keep it like it is and have a safety net like the exchange for the 15% that can't get health insurance?
Instead of forcing everybody to
exactly.
All right. All right, well, keep us updated.
I will.
Craig Gussin, our insurance expert. Now, you can always get in touch with Craig if you have individual questions. He'll be happy to take care of you. All right, you'd expect security